introduction, which Bob already did, but also just to give a little bit of a disclosure. So while I am serving right now as the interim director of the Center for Rural Behavioral Health, I myself am not a mental health provider. With that said, I've been spending a lot of my time in this space. I'm also have some experience in interprofessional practice, in research and other skills in terms of having community-facing programs that allow me to be a good fit to lead the center in the interim. So the title of today's, I did want to note, if you all have questions, please don't hesitate to raise your hand. I do enjoy the interaction, so feel free to stop me and we can have some questions throughout. There will also be an opportunity at the end to have questions answered as well. Okay, so I wanted to start us with this quote. This really reflects the title of the presentation, and I'm going to go ahead and read it and then share a little bit about why I chose to start with this. So, mental health problems do not affect 3 or 4 out of every 5 persons, but 1 out of 1. So I chose that because really we are all impacted by the mental health concerns that are happening in our society today. If you yourself don't haven't had mental health concerns, I would almost guarantee a loved one of yours has. So it really does impact each and every one of us. So it makes it something that we are all immersed in. So today I plan to walk us through and think about the current mental health challenges. Then we'll move to challenges specific to our region. And then we're going to think about some solutions or ways to look at this complex problem of mental health, both at individual and community level. I am going to start us, hopefully you all like crowd participation. I would like us to start with a practice I call a grounding. So grounding is a way to bring us into a space together. Typically I use these when I'm working with a group of people on a topic that can be somewhat emotional or spark some things within you. So I'm going to go ahead and read this quote in a moment, but what I want you to do is think about your thinking, okay? So what are you thinking about when I read these quotes? Then also, what are you feeling when I read the quotes? And I like people to think about, when we think about the ways that we're feeling, pay attention to like your body's responses, right? Because sometimes we feel things in our body, but we don't know what the emotion is. So if you're feeling it inside, just kind of reflect on where you're feeling and what you're feeling. So these are 2 quotes from Vivek Murthy, and he is the Surgeon General of the United States. And again, I'm going to read the quotes and then allow you guys to think about this, and then I'll ask for some participation if willing. Right now, the world you are inheriting is locked in a struggle between love and fear. Fear manifests as anger, insecurity, and loneliness. Loneliness is the subjective feeling that you are lacking the social connections you need. It can feel like being stranded, abandoned, or cut off from the people with whom you belong. Just take a moment and think about your thinking. Think about the emotions that you may have in response to this. And then I'm going to ask if anyone would like to share what they are thinking or feeling.
when I think about the quotes up there, I think of the disservice that our society is doing by the emphasis that we have put on social media. And that it is allowing our children to basically, find themselves kind of as islands of themselves, isolated. The only contact that they have with the outside world in many cases is through social media.
I saw another.
This just made me think about, in the wake of coming out of the COVID-19 pandemic, how there's a lot of research coming out, how there's now a loneliness epidemic that a lot of people are experiencing, which really that knowledge resonated with what you were talking about. And then just kind of thinking about how insurmountable of a task it feels to really make sure that people are feeling connected and feeling loved, feeling welcome, all of that sort of thing. And so while there's this hopeful part of me that there's things that we can do to change that, there is also kind of a helpless part of me that's like, that's a lot of work. And how can we, how can I as one singular person do that work? Yeah.
My name is Shelley. I just want to share as someone who's lived with chronic major depressive disorder for over 30 years, maybe longer. I've learned to try to listen to my body. So my chest was feeling pretty secure after worship, but it reminded me of, I don't know how long ago, but I came home and I just wanted to scream and scream and scream because of, and I talked to my husband, but the devastation of our planet and feeling so helpless. And I think because I listened to too much news, and to know that there's community though of people who are trying to work on that, can move, instead of just having anger and loneliness, you have to connect, or I have tried to connect with communities that are working towards healing that.
Y'all are previewing nicely what's to come. Thank you. Any other comments? Okay, I want to now share a few cases with you. And these are stories that I am sharing with you all so that as we get into some more of the informational content, you can start to make some connections. We will revisit these cases later. So I'm calling them our loved ones. So the first loved one is Matt. And I'm sorry, this is so tiny for those of you in back. But our first loved one is Matt, and he's a 76-year-old man who is married to his longtime partner, and they are both retired. Matt has experienced many health complications, mostly beginning about 5 to 6 years ago. These complications are related to his digestion and heart disease as well. Though the symptoms have been present for many years, they're somewhat mild, but do impact Matt's ability to travel and to spend time with his beloved grandchildren. About 5 years ago, other symptoms also appeared in terms of memory and the ability for him to express himself. And only recently, though, he was diagnosed with Alzheimer's and a form of aphasia. That means that he has a hard time expressing his ideas through using words. In recent family events, Matt has stayed away from the conversation, especially with his sons, because he's had trouble following the conversation as well as expressing himself. Okay, so that's our first case, Matt. Missy is our second loved one, and she's a 30-year-old Black woman, and she is married to a man who is in law school. She works at her local school district and has a 1.5-year-old. And she is pregnant with her second child. She moved to Minnesota many years ago after living in the South for most of her life. She was in New Orleans when Katrina hit and spent some significant time in the Superdome, and then moved to Texas, and then made her way up to Minnesota. Her childhood relationships with her parents were strained. Her mother was abusive to her, and her father was an alcoholic, but has recently gone into recovery from that. Okay? So that's our second loved one. Our third loved one is Marie, and Marie is a 21-year-old Black woman who is studying psychology in college. She's a dual citizen, so her family lives in the UK, but she's here in the US. Her brother also lives here in the US. He recently borrowed most of her savings to pay for a car so that he would have transportation to his job. She's recently admitted feeling overwhelmed with both school and life, has missed a couple weeks of courses, and admitted to having suicidal thoughts. And our last loved one is Mia. And Mia is a 7-year-old child. She is from a home with a happily married mother and father. They're white, middle class. They're very engaged in community and school. There were some concerns that came from the teacher in terms of Mia developing in reading and writing. And then later on, they saw a lot of anxiety around rules, particularly rules in the classroom or expectations that were placed on her, and attempting to meet those expectations. In fact, things were so bad that Mia was afraid to ask the teacher to go to the bathroom and would have accidents at school. She was recently diagnosed with both anxiety and ADHD. Okay? So I want you to think about each of these individuals. I did purposely select folks that span a lifespan, right? That are all different points in their life. Okay, so hang on to those, and we're going to get into some informational content, and then we're going to swing back to talk about those cases. Okay, so behavioral health. Behavioral health is that connection between one's behaviors, thoughts, feelings, and physical health. Behavioral health encompasses a wide range of conditions, including mental health disorders, substance abuse disorders, and other behavioral types of disorders. The folks that work in the area of mental health include mental health counselors, mental health therapists, social workers, licensed alcohol and drug counselors, psychologists. I just met one. Where's our retired? There you are. Retired psychologists. Also work in behavioral health as well. Mostly diagnosis of emotional disorders, mood disorders, personality disorders. Psychiatric nurse practitioners and psychiatrists are involved in behavioral health as well in terms of being able to prescribe medication. Okay. And then I have down here other allied health providers because often we'll see folks with mental illness or mental health concerns also need to be connected outward to other providers as well. So in terms of what exactly we are talking about, okay, so being mentally healthy, right, mental health, we can think of as a continuum. So being mentally healthy is ever present. We have both positive and negative feelings. It refers to thinking, feeling, and acting in ways that help you enjoy life and cope with setbacks, okay? So if we think about this on a continuum, right, there's sometimes we feel very mentally healthy, and there are sometimes we maybe not so much, okay? But to have a mental illness, that pushes us way farther on the end of not being mentally healthy, right? And that's when mental illness is when you are affected, your daily life is affected by the way you're thinking, feeling, behavior, or your mood, okay? So that's the real difference. This is a continuum, but when we get to that point where your mental health is impacting you so much that it is impacting your functioning in everyday life, that is what mental illness is. To give you an idea of prevalence, okay, 1 in 5 adults does encounter mental illness at some point in their lifetime themselves, okay? But serious and persistent mental illness is more like 1 to 20 adults, okay? So there is this range in how mental illness impacts us. The most common mental illness is anxiety disorders, which accounts for about 19% of mental illness. The next one is depression, which is about 8% of mental illness, and then post-traumatic stress disorder. The average time it takes someone from noticing their symptoms and living with symptoms to actually seeking help for mental illness is 11 years, okay? And that's average, okay? So some sooner, some later. But again, when we think about that spectrum of how we are impacted, a lot of times there's just some subtle things happening, right? And then things end up getting so challenging that then we're seeking help. But it's still 11 years, right, of dealing with symptoms. The impact of mental illness is also quite significant. The National Alliance on Mental Illness discusses a ripple effect, okay? So the individual is impacted by mental illness, but in a lot of ways. For example, having a mental illness increases your risk for chronic disease, and increases your risk for substance abuse. Families, then if we ripple out to the people around us, families are impacted by individuals who have mental health illness, right? By providing that caregiving. And then we ripple out even farther into our communities. So there's a disproportionate number of ER visits that involve substance abuse or mental illness. 70% of youth who are in juvenile detention facilities have one or more mental illness. And depression, and when we think about globally how mental illness is impacting us, depression is the leading cause of disability worldwide. And in fact, the numbers and the impact of depression on our global economy, okay, in terms of loss of productivity, is $1 trillion at the global level, okay? So there is this ripple effect that happens with individuals who have mental illness. And I did not plant her in the audience. But the Surgeon General, so Dr. Vivek Murthy, has put out a Surgeon General warning, okay? This is a document you can find online. I printed it, and it's actually like this thick, so I don't recommend printing it, but it is extraordinarily helpful in understanding the state of mental health. Now, this isn't necessarily looking at that far end of the continuum into mental illness. Really, we're talking about mental health as a whole in our society, okay? So, given these sheer numbers and the complexity of mental health challenges, Vivek Murthy gives that Surgeon General warning, okay, in terms of how loneliness is impacting our society. Now, loneliness is defined, I'm an academic, so I love to define things. Loneliness is defined as a subjective, distressing experience that results from perceived isolation or inadequate meaningful connections, where inadequate refers to the discrepancy or unmet need between an individual's preferred and actual experience. So this is a little bit like trippy to think about, because what you have to see is that each individual has some sense of what their experience, what they want their experience to be, what they want their social connections to be. And when we're loneliness, that means that we have not met that. So it's going to be individual for everyone, right? It's not X number of hours equals this. It's that difference between what you are actually having with social connections and what you want to have. So social connections or lack of social connections are detrimental to our health. The loneliness and social isolation can increase premature death, like 15 cigarettes can, smoking 16 cigarettes per day. Okay? So we all heard about how bad smoking is, right? Loneliness is equivalent to smoking 15 cigarettes per day. Okay? There's also an increased risk to cardiovascular disease and strokes. So those who report being lonely or isolated are at about 20 to 30% increased risk for heart disease or strokes. Social isolation also can increase the risk of developing dementia. Over half of US adults indicate feeling socially isolated, and the highest rates are among young adults, which the gentleman right there talked about, that those connections are becoming fewer and fewer. The rates of loneliness in young adults has increased every year since 1976. And also the amount of time adults spend together has decreased, and more time is spent alone. Okay? And that has increased over time. So technology is impacting social isolation. Those who use social media for more than 2 hours a day had double the odds of reporting social isolation compared to those who use social media less than 30 minutes. And children and younger people. A review of 63 studies indicated that loneliness and social isolation among children and adolescents increases the risk of depression and anxiety, and that risk remains with these children through adulthood. So it's very clear to see how loneliness and social isolation are impacting mental health, will continue to impact mental health for years to come. So, as Bob mentioned, I think in the little preview of today's talk, there are specific challenges in rural mental health care. Okay? So rural areas are often underserved for healthcare in general, and we're going to talk a little bit about how that disproportionately affects mental health. So mental health is significantly impacted by our connections in our community, which we just talked about. In Minnesota, roughly 20% of our population resides outside of urban areas. Prevalence of mental illness in urban areas and rural areas is the same. So that means it's occurring at the same rates, but access to mental health care in rural areas is decreased. So about 80 to 90% of healthcare workers in mental health are located in urban regions. Okay? And 60%, although Bob said 80, so maybe, I don't know where the right statistic is, of rural areas are in mental health care workforce shortages. Okay? And that is happening right now in rural Minnesota. There's also challenges in terms of accessibility and availability. So rural communities may be more susceptible to the stigma of mental health. Rural communities are tight-knit communities often. Everybody knows everybody. So if you are in need of mental health services, you may be having to go seek out your cousin or your pastor, or it's your teacher who is actually the mental health care provider, which can cause a barrier to some folks who don't want their community to know the crisis that they're in. In rural communities, there also is often a higher rate of alcohol, drug use and misuse as well. So that again compounds the difficulties in terms of the challenges that are faced in rural communities. This is actually an image. There were a couple images in this report, but I liked this one. This is similar to like mental health treatment facilities, but it really does, this is primary care clinics, but it really shows you how the concentration of healthcare is really in that Twin Cities area, and then gets less and less as you move out into greater Minnesota areas. Okay, so one of the things that we need to think about when we're dealing with mental health and this crisis that we're in is that it's a very, very complex problem. And that means that we do need complex solutions, okay? One of the things that impacts our ability to move forward with mental health and make significant changes is that our healthcare system operates very much in a medical model, okay? And I'm going to explain what this is and give some examples. So a medical model system means that if one individual person has a health issue, you would go see your doctor. That doctor performs an assessment, or healthcare provider, and they would perform an assessment, and then they would have a diagnosis and then a treatment. Okay? So if you think about in the example of someone who has ear pain, right? You would go to the doctor, they'd look in your ear, see if there was, something going on, the redness, swollen, and they would say, okay, now your treatment, I've now diagnosed ear infection, your treatment is antibiotics. Now, in the mental health space, this may look like someone who's feeling anxious, right? Goes to their provider, they might give the generalized anxiety disorder assessment, okay? They would diagnose anxiety and then prescribe the treatment of one-on-one counseling, or maybe refer on to a provider who could prescribe medication. So this approach really focuses on, so you can see I have an apple there. I'm really digging this metaphor I came up with, but you've got one single apple, okay? We're really just looking at that individual apple, okay? We're looking at that apple, determining, is it ripe enough? Does it need to get more ripe? Is it, are there bruises on it? How do I fix this apple, okay? That is the way that our medical system, our healthcare system is operating. So some other models that we can think about. So if we are going to really address mental health care crisis that we have, we want to start thinking about different ways to solve the problem, right? We need complex solutions. It's a complex problem. So these are two models that I think are helpful. So I'm going to talk through them very briefly. So a social model of healthcare actually comes out of like disability studies, okay? It's a way of thinking about what are the barriers that folks have for full participation in their life, okay? And those barriers can be physical, social, emotional, perceptions, but it's the idea that we want to look at that individual in the environment that they're in and shape that environment to meet the individual's needs, not just looking at what the individual actually needs. So hold on to that. Now, palliative care. This is a term that has moved very much from the end-of-life care to thinking about a patient-centered approach for healthcare and medicine. So what we want to do in palliative care is optimize the quality of life. Thinking about prevention, thinking about treating suffering across a variety, across the individual's life. Not just looking at it from one single lens. Okay? So if we think about those two models, okay, and think about our ear infection example, right? Something very, very simple. We might see that this individual is coming in chronically with ear infections. We can keep giving antibiotics, maybe, but we can also think about what is causing the ear infections. Well, maybe she's in swim class, okay? Well, what can we do? Can we do an earplug? Can we have modified swim class? Doesn't have to put the head underwater. What can we do to help that individual? Another way to think about this is if an individual has a broken foot, right? We could say, okay, let's patch up that foot, let it heal. Sorry you can't, this doesn't happen anymore, but sorry you can't get to your class on second floor because you can't get up those stairs. Medical model, okay, well that's on you. We'll fix your foot, we'll wait till you're healed to go upstairs. A social model would actually look at, hey, we could engineer this environment in a way that that person can still get up there. So where's the elevator? Who can help carry books? Who can provide another chair to put the leg up, right? It's really thinking about the environment. So when we think about this, again, going back to the metaphor, this is really looking at that community level, at the society level. This is looking at the orchard, okay? So hear me out with this metaphor again. This is really tending to and caring for the orchard, okay? It's picking up the grounds, trimming the trees, making sure the nutrients are in the soil, right? That those trees need to flourish. It's taking care of the orchard in hopes that the individual apples, right, will be healthier. And of course, there's going to be cases where that doesn't work. And that is okay. That's why we have the other model. We can intervene with individual level services. But if we ignore the orchard, we're just dealing each individual. We're not making any real change. So this was, again, brought up by someone in terms of like really looking at what are we living in right now, okay? Acknowledging and accepting that there is a lot that we are faced with, both at that community, society level, but individually. These things weigh on us, okay? Thinking about climate change and how that impacts us, right? How it's impacting farmers and their ability to produce the produce that they need to, okay? And how some of those things can lead to mental health concerns, right? Or illness. Food insecurity. Even here in our wonderful state of Minnesota, we have food deserts, right? We have people who can't access nutritious, fresh food and produce. We've lived in probably several financial crises now, and that how that impacts us. How the ways in which our middle class is shrinking, right? Families feeling more stress and strain. How does that impact us? Racial injustice, social unrest is impacting us, okay? We're feeling that in our bodies. Global pandemic, right? I mean, that's one we still have no idea. Well, we have some idea, but how this is truly impacting, especially our children, right? And with them living through that pandemic and having schools shift and social relationships and connections shifting. Rise in technology is causing more social isolation. So thinking about the idea that you do get some chemical hits, right, from social media, right? There's some, I always forget if it's dopamine or the other one, oxytocin, but you get something. Which one? Dopamine, thank you. But you get something from being on social media, but it is not what you get from face-to-face interaction, okay? So the release of dopamine when you are face-to-face with someone is at a greater extent than social media. So it's almost like you're feeling like you're, okay, I'm getting some social interaction, but it's not the real thing, right? It's like getting those empty calories, right? It's not really helping your body. It's not helping you be healthy. You need that nutrition. You need that face-to-face interaction. We're living in a time where there's been international crises, war happening. We're seeing it on the news, in the media, on our social media feeds. We're seeing and feeling that. And again, it's not at that level if we're witnessing it personally, but we are still seeing and feeling and carrying that within us. And access to healthcare, I did talk about briefly within rural, but just even thinking about the numbers that are of U.S. citizens that are underinsured or uninsured. And even for those of us who have really good insurance, we make those decisions, right? Am I going to go get this procedure done, even though I have wonderful insurance, but it's still going to cost me $800, right? We're making those decisions about our access to healthcare. Access to mental health care is even more challenging. The reimbursement rates aren't there. A lot of times those services come out of our own pockets. If we can't afford it, then we're not going to seek it out. Okay? These are real things that we're dealing with. So when we think about what we're being faced with at that society level, right? In our community, in our orchard, right? That is a big deal, and it is impacting us and our mental and physical health. Okay, I'm checking time. Good. Okay, so we're going to go back to our loved ones. And again, if you were thinking about someone on your own, or starting to think about these different models and how we can solve sort of these complex problems with, I keep saying complex solutions, because this is not easy stuff. So let's go back to Matt. So Matt, again, is our 70-year-old who has a diagnosis of Alzheimer's and aphasia, and also has some other health complications that are impacting his life. He is feeling isolated. I would guess his family members probably would say he seems depressed, right? Now, Matt could go, again, 76-year-old, might not be willing to seek out mental health care, but maybe goes to the primary doctor and says, this is how I'm feeling, or maybe his wife next to him is saying, this is what I'm noticing. Now, that doctor could say, all right, well, let's prescribe you some medication, right? If this was a medical model, that might be the direction. But if we look at this from more of a community model, okay, or a social model, we might actually hit the problem a little bit harder, right? So some things that we could think about. We know that memory is a challenge. We know that communicating with his loved ones is a challenge, right? Could we get other healthcare providers in? For my intro, you know I'm a speech-language pathologist. Can we get a speech pathologist, a speech therapist there to help him communicate, teach strategies?
Did they check his hearing? Because all of
Yes.
that goes with the hearing.
There you go. We can check the
isolation,
hearing.
speech, everything else. Sometimes that's the cause more than anything else. You can't hear.
Exactly. So looking at this from a multi-dimensional lens, right? And thinking about other aspects that are impacting him. Absolutely. And so there are strategies we can teach him, right, to communicate, ways that we can help him remember information, ways that we can help him express himself, but we can also teach the family lots of things, okay? We can teach the family how to interact with someone who has dementia symptoms, right, who is forgetting things. We can provide really safe spaces where we're doing activities together. That's a lot easier to communicate and to feel valued in that interaction if we're both sitting side by side in the garden and gardening, right? Then if we're at a dinner table, where if we have the hearing, and also the multiple people talking, that's gonna be a really hard, no matter which way you put it, that's gonna be a hard space for that individual, okay? So yes, we can address his mental health concerns through medication. There's no way we would probably get this individual into counseling, but we can also look at their environment and really think about shaping that environment to help him feel valued, feel safe, and feel included in what's happening. Okay? Our next loved one, Missy. So if you remember, she is someone whose life has been defined by childhood trauma, right? Both within her family as well as the experiences that she has had dealing with Katrina and all the aftermath, okay? So this is someone probably really does need one-on-one counseling, right? And therapy to work through those issues and how that impacts her functioning as an adult. But we can also think about the ways as a Black woman in Minneapolis, I didn't say that before, but might feel unsafe, oppressed, might have a hard time navigating in that space. So we can also think about what can we do so society-wise to help her and help her navigate. Marie is our college student who was severely depressed. I'll just say depressed. Where she was overwhelmed, not able to go to class, not able to really get up, get out of bed. And remember I indicated there were some financial challenges that were overwhelming. Well, yes, she probably needs one-on-one therapy, right? This is an individual who does need something, maybe even medication. I'm not sure. That is something she definitely needs. But what about what can we do to help her function, right? Can we look at grants or extra loans or something to help her financially so that is one less burden she has to carry? Can we talk to her professors? Work out plans for her to get caught up. So manage some of those other components, those other barriers to help her be successful. One other note with Marie, thinking about this particular individual, we've spent a lot of time thinking about social connection. This is one where Marie had admitted to having suicidal thoughts, okay? And she indicated in that very dark moment that she thought about a program at the university that she was deeply connected to. And her thought was, if I cause harm to myself, what will happen to those who care about me in that program? Okay? So thinking about how powerful that is, that social connection that she had. And then we have our sweet little Mia, who was so anxious that she was having accidents at school because raising her hand and asking the teacher or following the rules was so important to her that felt like something she couldn't do. We can think about, and again, Mia does need that support. What one-on-one counseling, what medication can help her deal with that? But let's think about the school, right? She had some reading and writing concerns. How can we help the family provide some support for her reading and writing? How can we help the family advocate in the school for these rigid rules, right, that they had? And then also thinking about reform in our schools. How can we provide and have those safe spaces in our schools for children that aren't as anxiety producing as they are currently? Because there's a lot happening in the schools right now that actually amplify the way that children are feeling. So again, I bring up these examples, and now I will disclose. Number one is my father-in-law, okay? These are all people in my life. Number two, my best friend. Number three is a college student I'm currently working with. And number four is a colleague's daughter. So these are all people in my life. And when I sat down and thought through that, I'm like, this is my life. Each of you have these connections and these loved ones. And really thinking at that deep level of how are we going to help support all people who are having either mental health challenges or illness. So this is where we get to the Center for Rural Behavioral Health. And this is the exact purpose of this center, right? Looking at a complex problem, acknowledging there are complex solutions, okay? This is not a one-size-fits-all organization. This is really looking at experts from the university and other partners outside the university coming together and working on creative, complex, innovative solutions for behavioral health. So some of the things that are happening, we're working on workforce development, and what that means is we're looking at both increasing the number of mental health providers as well as providing quality education to those providers who are already out there, to keep them engaged in the field and helping them be responsive to what is happening. We are looking at research opportunities to implement programming, okay, both in Mankato and out of Mankato in rural areas. Evaluating that programming and sharing that information so that others can learn and implement as well. And we're doing lots of community outreach, both to high schools looking for students coming up that might be interested in behavioral health, but also outreach to other local and national organizations. Again, so that we can share, we can learn from each other in order to, again, come up with some solutions to this complex problem. Some specific things that we're looking at doing, and we are doing, is focus on increasing individual service. Oh, yeah, sorry. Where was it? Oh, yes.
I can speak without. So I'm helping my cousin, and we're combining all of this past week. And problems, I don't know, understand it is so pressure right now to get the machine to get the grains out. A lot of times they're working too fast, they're working too long. And I went out there and I said, ride with him. I got up there in the combine with him. All of a sudden, we start talking and the problems start to decrease. Just because you got up there and you don't know, but he tells you what you don't know, and pretty soon the machine starts to work. Then we start thinking, what do we want planted here next year? All of a sudden, time changed. The machines work with us. So I thought just that way of belonging, my longing to get up in this machine, I don't know anything about it, but just being there, give him that he could correct the machine. He could correct the hurriedness, pushing the machine till it breaks. He could handle that. That was so interesting to feel that's all you had to do is just crawl up there.
Thank you for that. And I think what I've heard people talk about that, I don't like the sound from here, talk about that as like holding space, That's what you did. You gave that person space to open up, to share, to think, to process. And I think that's so important. So thank you for sharing that. So we are looking at opening a mental health clinic in the fall to address number one here. So focusing on individual services and increasing providers in the Mankato area. We are doing currently a needs assessment, which means we're talking to other providers in town and seeing where they have the longest wait lists, what are the services that would be most valuable for our community to have, and really building the clinic, both on, it's a training clinic for our students to prepare them and to produce the best quality mental health professionals we can, but it's also looking at our own community, determining the needs that we have, and building a clinic that will actually serve the community in our hardest hit areas. So that's number one. And we are also looking at programming then to push out into rural communities. That was a great example. A lot of the farmers that we have that are in that mental health crisis, they're not going to seek out one-on-one therapy. It's just not going to happen. So how can we develop that programming to address the needs, again, looking at the community, and provide spaces or places for folks to engage where they can develop some good mental health habits. So that's something that we're looking at. We're implementing our clinic, but we're also then looking at expanding our needs assessment more broadly and implementing some programs to more rural communities. We're also looking at that advocacy policy implementation level, so really focusing again on that orchard, not necessarily the individual apples, but what are the places and spaces that we can make an impact and advocate to change the way that we do things. So really looking at that level. We want to think about creating connected communities to decrease that isolation and loneliness, and I talked about that one already. I also wanted to leave you all with some final thoughts, something tangible to take with you. And thinking about at the individual level, I'm just going to talk through some things. Remember when we talked about mental health, kind of the continuum, how to keep yourself mentally healthy. So that's what I'm going to talk through now. Increase your relationships and extend your social interactions. We've just said it a million times, how important that social connectedness is. So really thinking about how you can take a few steps, right, to increase your connections to others. Sort of being an acknowledgement that, again, our phones are great, right? We feel so connected. But those in-person connections are so important. So in our example, Missy, who I identified as my best friend, those were all made-up names too. I forgot to say that, of course, because you could probably tell, all M's. But we made sort of a pact that every month we would see each other in person. She's in the Twin Cities, I'm here. But that connection, we stay in touch via text, social media, but to see her every month and to have that face-to-face interaction is hugely important to me and to her and to our relationship. And it feels so good, right? When you connect with the people in your lives and have those great interactions, it feels really good. Decreasing technology and staying present and mindful in moments of connection. I see this all the time in my family, right? We're all getting dinner ready, and then all of a sudden, we're waiting for the water to boil, and then we're all on our phones. And I'm always going to say, okay, put them down. Like, this is our time together. Let's just communicate with each other instead of staring at our phones. I also have a daughter who has anxiety, and she is one, whenever her emotions get high, she pulls out her phone, and I'm like, put it down, sit in your feelings, right? That is so important for us. you all are probably much better at it than our children, right? Because they've always had that escape into technology. So making sure that we are in those moments and we're feeling those feelings, it is so important to our mental health. Gratitude. Gratitude is one of those things that research-based strategy, if you express gratitude, it actually makes you feel better, okay? Such a simple thing to do. Think about the in-person, letting someone know how thankful you are for them, or a gratitude journal is really helpful. At the end of the day, listing things that you are grateful for, that can have profound effects on mental health. Meditating or deep breathing exercises are also, again, research-proven strategies to increase mental health. Simple, like 5 minutes helps. There's all kinds of apps that you can get. Meditating is something I never thought I could do because I have a mind that spins constantly. But when I get messy and I need that decompression, I will do a 5-minute meditation, and I don't know what magic is there, but the rest of the day then is a lot more doable. So something like that, as small as that, can have huge impacts on mental health. And then exercise is shown to be as effective as medication for treating depression and anxiety, okay? As effective. So getting, and I always say getting outside, like, it's not that you have to go, run 5 miles or anything like that. It's literally getting outside and walking has huge, huge health benefits and mental health benefits. I didn't put it in here, but nature and being in nature is, again, hugely helpful for positive and healthy mental health. Okay, I think, am I right on time, which never happens. So that's all I have, and I'm open to questions. This QR code takes you to the Center for Rural Behavioral Health website. So you're welcome to do that, and then my information, which y'all can't see probably in the back, is up here as well.
I just have a quick question. I know that you said one of the goals of the center is for like continuing professional development, continuing education for therapists. So I am a therapist, and one of the things that I see is there's a big struggle with retention.
Yes.
So like just even from my cohort graduating not even 10 years ago, there's already a couple people who are no longer in the field, which is concerning to me that we haven't even paid off our student loans, and they're no longer in the field that they spent thousands of dollars to be in. And so I'm curious if there's gonna be efforts made for like policy change, reimbursement rates through insurance, if there's gonna be any like lobbying or advocating on like the federal level for just recognition for therapists, because I feel like that's one of the things that then makes it hard for people to access care, is that therapists, we're just not making money, so it's not sustainable for us to even work, you know?
Yeah, there's some of that advocacy going on more broadly with other organizations, but also one of the things that the center is doing is we're engaged in a large-scale study with Wilder Foundation, which is looking at that retention issue. So looking at why people are leaving, there's also people aren't advancing in the field as well, so looking at those reasons, and then once we have the data, then that's where we would use that to advocate. But absolutely, I mean, you can imagine the burnout that happens amongst therapists. It's extraordinary. And there are also, Jenna Longren is a professor at Minnesota State University, and she is, one of her missions is self-care for therapists, and really thinking about ways that therapists can take care of themselves, again, in order to be there for others and persist in the field. But yeah, that's a point really well taken. Yeah.
Since Lou Frederick
Yeah.
saw this in the paper and came, I thought you should know this is Representative Boot Frederick, and he was kind of one of those people that supported this being developed and organized, so, thank you.
Yes, thank you.
Please tell them about the Northern Minnesota too, in the future.
Okay. Sorry, not to
Take it away.
not
It's
to
all-
try to
it's
take
all
any thunder
over.
from you, Dr. Holt. I just want to say thank you to Dr. Holt
Yes.
actually for coming and making this presentation. Round of applause for Long Story Day. And I actually want to share a personal story too about some of the things that we've been talking about, because we talk about that loneliness as an epidemic. I was just talking to my sister, who's a professor at a university over in Wisconsin, and she talks about how prior to the pandemic, she would go into the classroom, right? And I want everyone here to picture like their high school classroom, a college classroom, the professor coming in, the teacher coming in and saying, okay, now everybody quiet down, right? Trying to start class. She walks into the classroom now, and no one's talking to each other. She worries about how loud she's talking, that she's gonna scare someone. That's to put kind of that mental image into what we're talking about in this space, that epidemic of loneliness. It manifests itself in many, many ways. But I think it's kind of a tangible way when we think about those classrooms and how important that this is. So I'm proud of the work that we are doing with the center, that Dr. Mahowald is stepping in to lead the center, and I cannot emphasize enough how important that work is, just from a community aspect where we're training the future mental health providers while giving this community a space to potentially seek mental health care with that clinic that's getting stood up. And so it's incredibly important. I'm proud to be part of that. I serve on the board of directors. I actually got legislative funding this year. There's $1.5 million that we as a state legislature actually put towards this center to be successful. And I'm already having conversations with some of my colleagues about can we replicate this in other parts of rural Minnesota, because as Dr. Mahowald showed that map, there's a lack of providers across the state, and so if we can show in Mankato here the success of this program, we really want to replicate that across the state. And this is a space when it comes to mental health care that it doesn't matter what political party someone's from. Every single member of the committee that when I presented this bill to get this money for this, it didn't matter if they were Republican or Democrat, everybody's voting for this. But that's on a backdrop of we're having high schoolers come and testify saying, I can't get mental health care because my parents don't believe mental health is a thing. So there are real challenges out there. So the examples that Dr. Mahowald kind of put up, I would hope that everyone here can kind of say, oh, I see this in my life. Have those conversations with your family members, your friends, your neighbors, saying mental health is real. And we need to continue advocating for that. And it does also look like reimbursement rates to try to get some of those providers out there too, or to get more people into the field. So, sorry, I can stick around for questions too, but again, I want to say thanks for Dr. Mahowald for coming today.
Any last questions? All right, well, thank you very much, everyone, for coming.
Thanks for being here. Thanks for
There you go. Thank you for coming. You probably don't. You just need to get